I'm going to be doing my presentation on the Navajo Indian Heritage by me, Brianna Kuchelmeister. Introduction. The Navajo Indians are the largest Native American Indian tribe in the United States, with a population of over 300,000 people. Of those residing in the U.S., approximately two-thirds of them live on the reservation. The Navajo Reservation covers 27,000 square miles in Utah, Arizona, and New Mexico. A large amount of the population which reside on the reservation are near the Colorado and Little Colorado rivers. During prehistoric times, the Navajo and Apache Indians migrated to the southwest area of the U.S. from Canada. Prior to migration, the Navajo were wandering hunters. However, after the migration, they adapted the farming lifestyle of the Pueblo Indian neighbors. The Navajo people. The Navajo people are nomadic, wandering to find areas for their sheep to graze. While some of the more recent generations have taken on living more modernly, with updated homes and contemporary careers, there are still many Navajo people who continue to live the traditional lifestyle, residing in structures called hogans. Hogans are one-room structures made up of logs laid in an octagon shape insulated with mud. Each hogan has one door which faces the sun, with no other openings except for a small hole in the top for ventilation. You can see one pictured here. Communication of the Navajo. Navajo Indians speak an Apachean language which has many similarities to that of the Apache Indians, the Navajo migration partners. The language has strong affiliation to the Athabascan language spoken in northwest Canada, unlike any of the other American Indian languages spoken throughout the U.S. With no written language until the 1970s, most of the elders in the Navajo tribe only speak in the native language. Many of the younger generations are bilingual, growing up surrounded by the Navajo culture, but introduced to the modern world and language. Nursing considerations with communication. As a nurse, it is important to take into consideration cultural differences among diverse populations. Many of the elderly Navajo Indians only spoke their native language. Attempting to speak their language can be misinterpreted due to pronunciation being a key element to the language. The slightest mispronouncing of a word can give the saying a whole different meaning. Hiring an interpreter to translate or use a close family member ensures adequate understanding between healthcare provider and patient. In the Navajo culture, the language is spoken in a low, quiet volume, with many inflections of sound. It is thought to be rude to speak loudly. It is also thought to be rude to use direct eye contact. When eye contact is made, it is thought to be confrontational by Navajo people. Along with eye contact, pointing is also thought to be rude. The Navajo are comfortable with silence and have a greater personal space area than most Americans. Although they are not comfortable with touch, they do accept shaking hands, as this is a normal greeting for them. As a healthcare provider, it is also acceptable to call elderly Navajo by the name grandmother or grandfather, or a nickname. Family roles of the Navajo. The Navajo are matrilineal, meaning that their descendants are tracked back through the maternal line versus the paternal line, like many other cultures. Family consists of the nuclear family and the relatives, such as aunts, sisters, and other female descent. Relationships in these families are important, especially between brothers and sisters. Those are considered a more important relationship than that of a husband and wife. As a nurse providing care for a family, the appropriate female elder must be present to make the decisions. When a new life is brought into the family, they are not named initially because it is thought that a baby gains its soul and self-identity when they first laugh. So it is not until a baby laughs that they receive their name. Because of the close-knit bond of the family, as family members get older, it is the responsibility of the young to care for the elders. There are very few nursing homes on the reservation for this reason. If a patient does end up in a nursing facility, it is typically a long process, and the patient will end up residing far distance from their own family. Workforce issues. The Navajo Nation is lacking in education and also has a high rate of dropout when adolescents get to high school. With low education, it makes it difficult to obtain a job, as well as many Navajo Indians have very poor or broken English. As far as attendance for work, Navajo Indians have obligations to attend ceremonies, for example, the Ceremony of the Dead, which lasts approximately 3 days. With large families, this can mean many days from work. Another issue the Navajo people have to deal with is conflict. When there is issues between two individuals, a third party must be involved to help resolve the issue. In the workplace, it is also problematic to Navajo individuals when a boss or person of authority is a younger age than them. They are viewed by the Navajo to not have enough life experience to be a leader. Also, if the leader is a male in a culture where a female is a group leader, a male in charge might meet significant resistance from those that work with him. Bioculture ecology. The Navajo have a range of appearances and skin color from light brown to very dark brown. When caring for a patient of the Navajo descent with darker skin, assess the patient's nail beds for capillary refill. When assessing the patient for low hemoglobin or anemia, looking inside the mucous membranes for a pale color. Also, when assessing the patient for signs of liver failure, checking patient's eye whites for jaundice versus the skin is the best indicator. Many Navajo descents look like Asians. The individuals have epithelial folds over their eyes. They are taller and thinner than other American Indian tribes. High-risk health behaviors. The Navajo Indians practice many high-risk health behaviors which lead to an increase in other health problems. One of the biggest problems the Navajo face is alcoholism. Alcoholism can lead to many other health issues, harm to self or others, or even death. Some of the problems seen with alcohol abuse are motor vehicle accidents, homicides, suicides, and liver failure. Mothers drinking during pregnancy also are putting their babies at risk for developing fetal alcohol syndrome. Suicide is another high-risk behavior which is a problem amongst adolescents Navajo Indians. A study conducted by Grossman, Milligan, and Deo in 1991 surveyed teens about suicide. It asked the individuals if they had ever tried to commit suicide and what factors were attributed to them feeling that way. It was found that exposure to either a friend or family member that had committed suicide was the greatest factor in an individual attempting suicide. Other risk factors included family structure, alcohol usage, religious affiliation, presence of a natural mother, or presence of a step or adoptive father. Other high-risk behavior is poor lifestyle, high-fat diet, sedentary lifestyle, obesity, depression, which are all setting the youth up for potentially developing type 2 diabetes. In a study conducted, it was found that in the Navajo children ages 15 to 16, the prevalence of diabetes increases significantly than that of less than 10 of age. It is thought that an increase in consumption of carbs and poor genetics has an increase in the prevalence of diabetes in the Navajo population. Tobacco use amongst the Navajo increase the likelihood of developing cancers later in life, which is the third leading cause of death among the Navajo people. Nutrition. Food is a very important part of the Navajo culture. It is used in many different life events as well as ceremonies and religious celebrations. Sheep is the main source of meat on the Navajo reservation, especially the sheep brains, which are considered a delicacy. The Navajos do not have access to many fruits or vegetables year round due to the weather, except for in the fall when they have access to corn and squash that are harvested. Many Navajo Indians suffer from lactose intolerance, so they are unable to drink milk or dairy, leaving their diet deficient in vitamin D. Pregnancy. The Navajo women do not practice any form of birth control, which means that family sizes are typically larger than that of the average American family. If a woman is pregnant and delivers twins, it is thought that it is because of some kind of witchery. It is such a superstitious belief that one of the babies must die. Along with the belief of twins, there are many taboo or other suspicious beliefs regarding pregnant women. For example, you are not allowed to wear two hats at once because you will be having twins. And you are also not allowed to kill animals while your wife is pregnant, or your baby will look like a bird. While the mother is in labor, she is to wear a birthing necklace, which are made from juniper seeds and are to help make sure that the birth goes smoothly. Many Navajo women will refuse to deliver their baby in the hospital because of the deaths that have occurred there. There is a belief that it is bad luck to be around someone who died, which is why pregnant women do not attend ceremonies or look at those who have passed away. Once a baby is born, the placenta is taken and buried right away, the thought being that the placenta attaches the baby to the land. Child rearing and nursing considerations. As Navajo babies, they are kept in a device called a cradle board. Many of the infants are kept in this device until they are able to walk on their own. The use of cradle boards is not good for the infant's hips and can cause dysplasia. However, recently the Navajos have been using diapers, and that has decreased the prevalence of hip dysplasia. As a nurse, it is important to stress the danger of the cradle board and the long-term damage to the hips with prolonged use. It can also be brought up to use a diaper to help decrease this risk without taking away their cultural ways. The use of formula over breast milk has become increasingly popular, but with the increase of formula has come an increase in dental problems among little ones. Dental caries are a big problem because many children go to bed with a bottle of milk or juice, causing rapid tooth decay. As a nurse, going over the importance of proper oral care and dangers of bottles at bedtime can help decrease the problems with the dental caries. Also, discussing the benefits of breast milk as an option, but not pushing the mother one way or another. When Navajo individuals have children to grow their families, sisters take on the responsibility of her children as well as her sisters. It is not uncommon to see Mongolian spots on the lower back or butt of Navajo children. It may look like a bruise or other questionable marking, but as a nurse we must be aware and know what a Mongolia spot looks like. Death rituals. The Navajo people have a great fear of their dead because they believe that the spirits are able to come back and take control of other people's bodies. This can be caused if the deceased individual is not buried accurately. When a member of the Navajo tribe dies, they are to go to the afterlife as soon as possible. A cleansing ceremony is performed so the spirit does not take over anyone else's spirit. Family members are not to perform the ceremony, and bodies are never to be embalmed. The body of the deceased individual is buried about 4 days after the death at a specific funeral ground. The horse that is used to transport is murdered and buried with the deceased individual, thought being that the deceased member of the tribe would have a horse to ride in the afterlife. If the family member dies in their home, the hogan, it must be abandoned or a ceremony must be performed to cleanse it again. The Navajo culture is to not show expressive emotion with that when an individual dies, it is proper to not show a lot of emotion or expression. Spirituality. The Navajo are very spiritual people, full of beliefs and superstitions. As stated previously, their houses have one entrance which faces in the direction of the sun rising. The main meaning of life for the Navajo is to be one with nature, which every morning when the Navajo people wake up, they pray for that very thing. If an individual falls out of harmony with nature, that is where disease and illness come from. It is thought that an evil spirit or witch is to blame for falling out of harmony with nature. Healing ceremonies are performed for sick individuals in hopes that they can regain the harmony and be restored mentally, physically, and spiritually. The Navajo believe in one creator, that all things, living and non living, are part of the spiritual world, and that each person is made of the mind, body, and spirit. Healthcare practices. The There are not many hospitals on or near the Navajo Reservation, which makes access to care difficult for individuals. Due to the fact that many individuals are not able to get to the hospitals, immunizations go missed, and it increases the chance of deadly disease outbreaks. The Navajo believe that when they have an illness, it is because that they have fallen out of harmony with nature. Because of this, if you are experiencing pain, it is deserved and one must endure it. Mental health is thought to be a product of witchcraft. A special healer must be consulted to deal with the mental health patient. They wear the color turquoise because it is thought to keep evil spirits away. If a person passes away, it is not acceptable for the family to ask for an organ donation or autopsy. Folklore medicine and the medicine man. The Navajo Indians believe in that the healers in the tribe would take care of them when they fell ill. The medicine man woman would be used to diagnose illness and treat them accordingly. There are three types of healers: ones that practice for the power of good, ones that practice for the power of evil, and ones that practice both. The practitioners in the tribe divide their knowledge into three different levels: preventative measures, treatments, and health maintenance. Medicine men will often give patients a pouch with a blend of different types of herbal substance to help the ill individual. As a nurse caring for a patient of a Navajo descent, it is important to never remove a medicine pouch from an individual. Other than the average healer, there are crystal gazers who are used to see what caused the patient's illness or problem. They, however, cannot treat a patient. And singers, who are those who heal through song, while placing their hands on the patient to remove any disease-causing illness from the body. As an role of the advanced practice registered nurse. As an APRN, it is important to be culturally diverse to the different cultures that you may encounter in your practice. As for the Navajo, it is important to remember that an interpreter is a key player. If an individual cannot speak or understand adequate English, they are not comprehending the treatment plan or results the provider is giving them. Before starting treatment with the patient, making sure the gatekeeper is present to make the decisions. As a nurse, making sure that we approach our patients in a way that gains their trust is important. Asking them to tell us what is wrong versus telling them what we think is wrong, going along with their beliefs. We need to support them even when they are showing no emotion or very little emotion for the deceased loved one, because that is their culture, the way their culture has ingrained them that they need to be. We also need to do a lot of health promotion teaching, especially with healthy food choices from a young age to help prevent diabetes type 2 in the adolescents. Get adolescents care for their issues that may trigger depression or suicide. Also teaching all ages the dangers of alcohol and provide options for safe rides to try and decrease motor vehicle accidents related to alcohol use. References, and that is the end. Thank you.